Greetings, everyone. Thank you for joining us here at the 1947 Partition Archive. Given the critical situation South Asia is facing right now with the COVID-19 crisis, we are adding some new programming to our channel to answer your questions about the crisis. Today's topic will be grief management. My name is Titash Biswas, and I'm volunteering to bring you this episode. Joining me is Ms. Taymia Zahidi from Karachi University, and she also works as a Senior Content Marketing Manager at Logicose. So Ms. Tamiyah Zahidi is a teacher trainer and an aspiring educational psychologist. She has recently completed her master's from Karachi University, is pursuing a postgraduate degree in research in psychology. She has conducted multiple teacher training sessions in various schools, along with workshops on diverse topics related to mental health. Ms. Taymia works extensively with underprivileged schools who have limited opportunities and access to these activities. She's currently working as a senior content marketing manager at Logicose and has been working as an educational coordinator at Namud Schools since the past 3 years. So welcome, Ms. Dr. Zahidi.
Hi, hello. It's so nice to be here with you today. Thank you so much for having me.
It's great to have you too. So should we just move to the questions that we have, or do you have something to say as an introduction maybe of yourself?
So I just want to say for myself, I have been working with many people and in the individual capacity and in group capacity. And truly the pandemic is a very hard situation to deal with. And it is amazing how you guys are trying to reach out and help people. And I really appreciate this. And I hope that I can somehow manage to convey whatever I have learned and be helpful towards the cause, inshallah.
Thank you so much, Dr. Zahidi. So I think I'll just be moving to the questions right now.
Okay. Sure.
So since we're talking about grief management,
Yes.
it would be great to learn a little bit about if grief is associated with possible development of psychological disorders.
Okay. So first we need to understand what grief is. Grief is a feeling. It's an intense hopelessness and despair. It's a very negative sort of feeling that incapacitates a person and leaves them feeling hopeless, firstly, and distressed. So grief is experienced during a lot of things in life, and they can be major life events or loss. And we have been experiencing loss and negative events throughout this pandemic on a global level. So grief has become a sort of a social, sort of a very global experience right now during this pandemic, when because so many lives are being lost and so many people are getting sick without the possibility of social contact. So how grief leads to psychological illnesses, mental illnesses, is that it causes triggers in people who are already susceptible to mental illnesses or have previously experienced mental health issues, and they have recovered, but these intense grief episodes have led to such extreme negative emotions that they have made people all of these symptoms do get triggered during the grief episodes. So this is why we need to learn how to manage grief, so that psychological illnesses may stay within a manageable level.
Right. So what you're saying is grief is an indispensable part of life, but it has been inside, like it's so intense because of the pandemic right now.
Yes, it is. Of course, it is a natural part of life, and it is inevitable, and we need to learn how to manage it. But during the pandemic, the intensity and the frequency of grief has increased multifold,
Mm-hmm.
which is why it is more important to learn how to manage it right now.
Mm-hmm. So COVID-19 is as much a social crisis as it is personal. So in such a situation, how do we seek care from and offer it to our near and dear ones?
This is true that usually when we experience situations like these, it is on a personal level. People get sick, and we experience the entire process of someone getting sick and getting vulnerable on a family level. But here, the situation is different in a sense that it is a global experience that people in every single country are aware of and are experiencing at the same time. So how we need to learn how to reach out to others and how to seek help, right? So that's your question. That is a very great question, actually. This is the most important aspect of grief management, because unless you are able to seek help, you won't be able to feel better and manage your grief. And you also need to give help. So I, throughout my observations, the pandemic has been lasting since almost a year and a half. So you need to be very vocal about your feelings. Mostly the people who are not vocal, or who are feeling like they are intruding on others, are the ones who are not able to and who are not able to seek help. I'm sorry, the screen changed, so I got a bit confused. Okay, so there are ways where you can in which you can stay social, right? And there are ways in which there are numerous platforms. It includes economic platforms and social platforms and numerous other ways in which you can help people. And these two things go side by side, and sort of like feed into each other. Unless you are helping others, you won't be feeling like you're being helped yourself. So if it is difficult for people to reach out and ask for help, what is the next best thing is to help someone, and then you will feel better. So you this can be done in multiple ways, and it's very difficult to actually suggest how this could be done, because we are, everyone watching here must have a different experience and must have different circumstances. So you need to learn how to identify these circumstances, and you need to learn how to navigate them in in your own capacity. You need to learn what are your resources and how you can use them in helping others. So that differs from person to person, and it's sort of a personal analysis of whatever you are able to do.
So offering help is also a way of seeking help in itself.
Yeah. Yeah, because it does like produce a connection between you and others, and it makes it opens a gateway. And often when others receive help from you, they are willing to reciprocate that relationship.
So
Yeah.
how to overcome the feeling of being engulfed by a sensation of loss that is occurring simultaneously at so many levels as we see right now?
it is important to understand that it is indeed being experienced by others. So other people will understand what you are going through if you just reach out um, share your feelings. So here, loss is extremely intense, and the feeling of loss is so difficult to deal with because it does make you dysfunctional. It makes you very it just leaves you so incapacitated that you are unable to function as a normal person and complete normal day activities. So the first thing is to understand that other people are experiencing this too. They will understand if you reach out. You must seek help from the people you love and also from professionals in the field of psychology or mental health, other mental health professionals who will be able to help you biologically and mentally.
So, how can you recognize the thin line between grieving and signs of depression or anxiety or some sort of mental disorder?
So, yeah, this is a very great question because grief and depression are extremely similar. They they are overlapping, and they have a very similar symptoms. We need to recognize that thin difference between the two so that we know when it is time to seek help and when it is as grief alone does not require mental health assistance because it is a natural feeling, it is a natural phenomena. But once you start to get into depression, and once you move towards that dysfunction in life, that is when you need to learn that it is time for you to seek help. So the major distinction here are two things. So, grief, although alone in itself, it does produce a feeling of loss and is a negative, an extremely negative feeling. Um, the major thing is the dysfunction and distress. The second thing is distress. So if you are feeling like you are dysfunctional and you're not able to perform the daily activities that you were normally able to do, that is when you need to reach out and tell people that, hey, I I used to be able to get up in the morning. I used to be able to do all of these activities, but I'm not able to do them anymore, and it's really affecting the way I function. So functionality is important here, and if you are feeling like you are not able to function, then that is the time that you need to do something about it. And the second thing is extreme distress. So extreme distress causes numerous negative consequences. It is an exaggerated feeling which is beyond what is considered as acceptable or normal. So you might feel distress and loss in grief as well, but in depression, it comes with a sense of hopelessness, and hopelessness is what is alarming, right? So distress alone may not be as alarming as it is when it is accompanied with hopelessness and feelings of extreme, when you think about hopelessness, it means that you have no hope for the future. You have no you don't think that things can get better. That is when you need to seek help. This is the thin line.
Right. So, how to reflect upon a crisis that is interpersonal but associated with a larger social crisis that the pandemic is?
Yeah, it's important to realize that your personal experiences are important too. And just because everyone else is also going through pain and loss doesn't mean that it invalidates your feelings. You must understand that you, as a unit of the society, you as a small part of the bigger picture, are just as important as everyone else. And you need to realize that even though this is a social issue, yes, it is a social issue, but we are here as mental health professionals to help you as a singular person. We are here to help you get over this phenomena, because it is often the people who don't realize that who are left behind in this sort of a race. A pandemic is a very a unique situation, and it is a very rare thing to be experiencing. It Yeah, so um, it is extremely hard to give yourself the importance, that sort of importance. It's even difficult for us sometimes, even though we have studied so much regarding how to put yourself first, and how you are important as well. But we feel like, oh, everyone else is going through this, I'm not that important, or these feelings are not that unique in me. But they are indeed. You need to reach out, and the most important thing is staying connected with your loved ones. So the thing here is that the most major, I would say, challenge is that we are unable to leave our houses, and we are unable to meet others, and produce that sort of social connection. So we have to make use of our technology. Technology is your best friend during the pandemic, because this would not have come at a better time, when uh, people have such high-speed internet and video options available, and all of these tools that we can certainly use in order to stay social, like we are doing right now. We are hosting a global event through video, and I am present here, you are present here from another country, and we are hosting this wonderful event. This is certainly the kind of thing that needs to be done in order to, like me as a person, reaching out to you as a global community, all of my viewers. So yeah, this is how we should definitely um, play our part and reach out to others as well.
So it's equally important to not invalidate the feelings of your loved ones while not invalidating your own when you're going through this.
Mostly what we do is we invalidate ourselves more than anyone else. So we need to be very mindful of that. Yeah, definitely.
At what point do you think one is supposed to seek medical care? Like when feelings of grief seem unsurpassable, like how do we identify we're going through something that's more than grief?
Okay, so mental health professionals, they are told for at least 2 months after experiencing loss, people should not, like mental health professionals should not diagnose an illness such as anxiety or depression, because loss produces such extreme feelings that it takes at least 2 or 3 months to deal with those emotions, and to learn how to manage them. So if after 3 months of experiencing loss, you are still experiencing dysfunction and extreme distress and hopelessness, you should seek out, even if you think that it is not too extreme or too important. It is still like for example, when you go to the doctor, when you have a slight fever, you go there and you see that other people are coming with much severe illnesses. They may be coming with chronic illnesses such as even like TB or cancer or whatever. So you need to realize that your ailments are just as important as theirs, even though it might not be at the same level. But you need to fix that fever, or it will get worse, and your symptoms will drastically, like sort of go in a downfall. So it is important that you reach out at the first sign of grief, of like dysfunction and distress, so that you can like just catch it as sort of at the initial level, and it doesn't get um, progressively worse. It will get worse if you do not pay attention to it. It is important to pay attention to these things, certainly.
Mhm. So, how to identify signs of trauma or that of possible paranoia in our own behavior?
In our own behavior, you see this, yeah, so behavior differs from culture to culture and from person to person. And what should be the main criteria is that the person's previous behavior is the best thing and to move forward with. It creates like sort of a baseline for to judge future behavior. So you should see how the person was functioning before they experienced the trauma, and how they are behaving after they experience trauma. There are many symptoms of trauma. There's like a huge list. It's different for everyone, and it will be different for you as much as it will be different for me. Everyone displays trauma, symptoms of trauma in various ways. So it is important that you keep yourself in check, and you analyze your behavior in retrospect, in reference to whatever you were experiencing before you experience the trauma. The easiest thing is to understand yourself, and then it is to understand your close family members, your close relationships. So you should constantly be aware of yourself. That is the first thing. Self-awareness is extremely important when it comes to trauma or other symptoms that people are experiencing during the pandemic. And the second thing is to be mindful of the people who you live with, your family or your close friends, and notice how their behavior has changed, especially if there has been a loss in your family. If you have lost a close one, pay attention to the behavior of your siblings, for example, or your parents, or whoever it is that may have been affected by the loss. And if there are such symptoms, such as inability to control negative emotions, or extreme like talks of hopelessness, and even it may be that they're talking about suicide, or I'm sorry if this is triggering. I'm trying very hard not to use these words, because it can be triggering for a lot of people. But if
But it's
they are,
also important that we address them, right?
yeah, definitely, in ourselves and in the people who are close to us.
Mhm. How to self-cater to your mental well-being in such trying times? I'm asking this question specifically for families, as you know, in third world countries, in developing countries. It's not always very easy to seek mental health care for a number of reasons. So, how to self-cater to your mental well-being if we are in such a situation where we cannot, for example, seek medical care or seek mental health care in professional terms?
Okay, so even in third world countries, I do think that you have access to internet. in like even if it's not a high speed internet, you should be able to access internet. So the main thing here is to understand how mental health professionals work, so that you can apply those things to yourself. You should do research, intensive research on how these things go about, so that you are informed, right? So the main thing is the when people are coming to mental health professionals, they have decreased functionality, they're dysfunctional, and we talked about distress. So these are the two things that we need to sort of manage, right? So the first thing that you can do for yourself is to increase your functionality somehow, right? So how you can do that is in a number of ways. You can do that on a personal level by making a schedule. A schedule is an extremely powerful tool when it comes to functionality. You make like a daily, you can make a daily schedule or a weekly schedule or even a monthly one. You can line up your tasks and divide it according to time and time slots. And you increasing functionality can happen in numerous ways. This scheduling is one of those ways, but you can do a lot of other things. For example, cleaning up your room, and it can be the little things, and like um, sort of like um, you can even decorate your space, workspace, or your room, and just these little things that can somehow improve your functionality as a person. And the second thing is to decrease the sense of hopelessness. So you can maybe start a personal diary, because therapy works in numerous ways. There's art therapy, there's play therapy for children, there is family therapy, and all of these numerous things that approaches that people, mental health professionals use, so to help people. So what you can do is you can see what works out for you. Usually when you go to a mental health professional, they ask you how you want to go about it as well. So you are actively taking part in coming up with like a treatment plan and a routine that you can follow with your therapist. So if you're into art, do art. If you're into other sort of things, if you like reading, read books. Just like do anything to stay functional and decrease that sense of hopelessness in yourself and in others around you.
Mm-hmm.
Yeah, I hope that answers the question.
Yes, it does. So I mostly asked the questions that I have from my side. And I have a question here from Vikrant Guleria.
Okay.
So he's asking, I can no longer relate to a friend of mine who I've known for almost a decade. Our experiences and learnings from the pandemic were completely different. I chose to move forward, whereas he chooses to stay in place and feel the pain and loss over and over again. Does my inability to hold on to the past make me a better or worse person?
So you should realize that everyone will react differently to the same situation, right? So everyone can goes through the exact same situation, exact same level of loss, and react differently to it. Two people, for example, siblings, they can react completely differently to the same situation, and that is completely okay. Everyone is different, right? So if your friend has reacted differently than yourself, you must realize that you are right as well, and they are right as well. There's no wrong way to experience to react to these situations. Okay. The second thing that is important is to realize that people will change, especially during the pandemic. Uh, you cannot make it stop. People will change, and the people who you love dearly, they will they will go through learning experiences that will alter their behavior somehow and their thought pattern. You Empathy can be difficult in these situations because it's so difficult to accept that the people you love have changed in any sort of way, but uh, try to look from their perspective as well and to help them overcome this. If your friend is experiencing these things over and over again, this does happen. You What you can do is try to make them snap out of it somehow, because it's like a cycle. It's a constant cycle that you need to break. But you can try talking to your friend, but the best thing would be to leave them be for a while, and you'll see there's that window. There's just a small window which opens where they want you to enter their space and actually help them. And you need to be very mindful and aware of where that window comes so that you can step in and you can help your friend overcome this problem, because I assure you they don't want to stay in that cycle either. They are themselves very um, and like distressed, and they want to come out of it, and they are unable to. It's very difficult for them. So what was his name? Vikram?
Galeria.
Yeah. So I hope it answers your question, Mr. Galeria. Do we have any other questions?
I don't see anything. But if there is any other point that you think is important to address or you'd like to add to the discussion that we've had today, please go ahead.
I just wanted to talk about the genetic factors that come with grief. It is we need to realize that some people have the genetic susceptibility towards like getting mentally ill. So what happens is that these factors are present in our genes, and usually they get triggered by environmental factors. So it makes some people more likely to gain to develop mental illnesses, right? So and these are people who are at risk, at risk individuals. These environmental factors can vary from early childhood experiences to trauma to abuse to these symptoms of grief. And we should just be mindful of how everyone will react differently, right? So it can depend on the personality of the individual and their genetic susceptibility. And if someone does have mental health issues that run in the family, we should be more mindful and more proactive when it comes to seeking help. For example, if depression runs in your family, you should run to the mental health professional at the earliest signs, and you should tell them, hey, my mother experiences depression, my aunt experiences depression, and I think that if I am experiencing these things in life, I might also develop depression. And definitely the mental health professional will help you somehow. And the second important thing is to know that medication, it does not mean that you are relying on something else. It's just there to help you. Many people are so they take medications extremely negatively, and they are very resistant to accepting any sort of medical help. When it comes to mental health, remember that it is just like other biological illnesses. These things that you are experiencing, emotions, are completely biological and neurological. So you might need some assistance with medication to help you recover. and that is completely fine. It does not mean that you are sick, or it does not mean that you as an individual have failed. Please do not feel that sense of failure, because even me, I am a master's in psychology, but I have needed medication at some point in my life. And
Mhm.
it is, mental health professionals do take medications too, and it is not a mark of failure or any of these things. So these are the two things that I wanted to point out: the genetic factor and the medications.
Okay. Um, so I think we're mostly done with all the questions that we had for this session. Thank you so much, Dr. Zahidi, for joining us again. We will be hosting episodes on numerous topics related to the pandemic several times a week at 9 a.m. India time. Follow us on Facebook or subscribe on YouTube to catch all episodes. Thank you again, Dr. Zahidi. It was great to have you today.
Thank you for having me. It was lovely being here. Thank you so much.